the clinical presentation also offers certain differences. The onset of disease, the first symptom in particularly Mexican Americans is usually optic neuritis. And the reason of this is not totally understood, but genome-wide association studies that had been done in large groups of Latin Americans of Mexican ancestry shown a very significant portion of the genetic pool to be due to ancestral Asian genetics, which is part of the indigenous makeup. So that's probably the reason of this particular tendency. The age of onset is also much younger than the white Caucasian counterparts, at least 3.5 to 4 years earlier. So it's a disease that much younger individuals, as far as they view of the symptoms and the disease in general. The early onset of disease in Latin American populations comparison with other groups, particularly white Caucasians, appears to be one of the reasons for rapid disability. In fact, the so-called EDSS, which is the disability scale that we use in MS, it shows that these people tend to become more disabled. Now, access to early therapy is one of the societal issues that probably we have to consider. However, these patients may become more rapidly disabled than other groups, and that probably may affect also the survival time, although so far mortality rates have not been affected that much in Latin Americans as it happens in white Caucasians and African Americans that tend to have a high mortality rate than Latin Americans in general.